Thank you for tuning in today. We will be discussing low back pain, and first, we're going to go over some anatomy. The lower back is comprised of the lumbar spine, sacrum, coccyx, and your SI joint right in through here. This is L1, L2, L3, L4, L5. Top of sacrum attaches L5 to S1 here at the facet joint. At the very top, we got T12, which attaches your last rib, and T12 will attach to L1 at the very top here. There are many contributing factors to low back pain, but let's go ahead and take a look at the side view of the lumbar spine. This here is a vertebral canal. There's an exiting nerve that runs down the leg and supplies muscles in the low back and also down all the way to the feet. So anytime we have disc issues where the disc height is decreased, we start to lose fluid in them, this vertebral canal here gets actually closer, and then that exiting nerve root has less room to move in and out of and send good signal, and it'll get pinched on if this gets too tight. There's areas in through here where you'll actually have extra bony growth, and that's called stenosis. Right back here is the facet joint, which contributes to the motion of the lumbar spine, but it also has 25% load bearing on the vertebrae, and the other 75% comes from the disc. This is the SI joint in between the ilium bone and the sacrum bone. So the space right in between, that's the term when you hear SI joint. A lot of issues can come from that joint, sending pain out to the hip, down the leg, and also slightly upward. Another area where the sacrum can get compromised is at this facet joint where L5 contacts S1 at the top of the sacrum. The same nerve that innervates the disc also innervates the joint in between the facet joint and the skin and the surrounding muscles around it. So if you ever get an issue with the joint level or a nerve or the disc, that nerve will send a signal to all this area here, and also to the muscles, the fascia that surround it, which act like a tattletale system whenever something gets compromised. If the joint level gets injured or pinched or tight, doesn't move well, you're going to get some signals that are going to radiate outward. So today we're going to be going over some strategies to help that move the facet joint better, to allow more mobility to go through this vertebral canal. Okay, let's get started. Today's first exercise is going to help with lumbar mobility. Remember, I was telling you about the facet joints, so we're going to get those moving to kind of get some lubrication in the actual joint level itself. Sometimes that can get compromised, and the muscles that surround that joint will get tight and pinch and make that facet joint close, which gives less room for mobility of the joint itself, but also brings that area of the nerve closer. So what we're going to do to help mobilize the facet joint is moving your knees side to side with your feet together. These are called lower trunk rotations, and at first you may not be able to go all the way down, but as you go, you're going to start getting more flexibility in that joint. And I like to do about 20 repetitions, side to side. Now that we got our lumbar spine mobilized, let's go ahead and move on to some stretches that are key for getting your hips loosened up. This first stretch is called the Piriformis Stretch. What you want to do is grab your knee and you're going to pull to the opposite shoulder. You're going to hold this stretch for 30 seconds, and you want to repeat this at least twice. The second variation to the Piriformis Stretch is where you have your leg in this fashion, and you're going to grab your opposite leg and you're going to pull back towards you. Same thing here. You're going to hold this for 30 seconds and 2 sets each of this. The next exercise is called single knee to chest. What you want to do for this one is you're going to put your leg down, and the opposite leg you're going to pull up towards you. You're going to hold this for 30 seconds, and you also want to repeat this for 2 sets. This is going to work on your glutes. This next exercise is going to help stretch your hamstring muscles behind the thigh right here. You want to get a strap, place it around your foot, and what you're going to do, just hold the strap and you're going to pull back towards you. Make sure your opposite knee is bent, and you're going to hold this stretch for at least 30 seconds. If they're extra tight, you want to hold it for a minute, and you're probably going to do at least 2 sets of 30 seconds or 2 sets of a minute. Tight hamstrings can also contribute to low back pain. The hamstrings will attach to the ischial tuberosity, so whenever those are tight, it'll pull on the pelvis and it'll rotate, so that can cause also misalignment in the low back itself. This next exercise is going to be stretching your IT band and also your gluteus medius on the side here. What you want to do for the IT band is you're going to lower your opposite leg, put a strap on the foot, and you're going to pull crossbody. So if you don't feel it kind of on the side, you also may be pulling up too high, which will be engaging your hamstrings. So for the IT band, you want to bring it down lower and then pull it across, and then you can feel a stretch over here on the gluteus medius, some on the low back, and on the side for your IT band. And especially for people with hip pain or SI joint pain, this one definitely can contribute to some dysfunction and some soreness, so you might feel a really good stretch on this one in your back and in your hip. And you want to hold that one also for 30 seconds to a minute, and you want to do that for 2 sets as well. So now that we have the lumbar spine mobilized and your hips more flexible, let's move on to some strengthening of your low back and also of your SI joint. So what you want to do is bring your legs down, and today we're going to be doing what's called a glute squeeze, and that's going to help strengthen the glutes that surround that SI joint and the low back region. So this one's very simple. All you gotta do is have your legs straight, and you want to squeeze your bottom together, and you're gonna hold it for 5 seconds. So just squeeze and then relax. You want to repeat this for 10 to 15 repetitions, and you want to hold it for 5 seconds. Now we're going to go over the transverse abdominis. So earlier in the postural video, we went over strengthening of this transverse abdominis muscle that is nature's back brace, and that wraps around this way versus being vertical like your six-pack muscles, your rectus abdominis. So transverse abdominis goes this way, and the way that you're going to contract it is you're going to feel for these bony landmarks on the top of your pelvis here, and you're going to go just on the inside of it where it gets soft, and then what you're going to do is you're going to cough. So that's going to kind of push that muscle up at you, and then that way you can kind of identify what you're looking for when you do the exercise. And once you've found that area, you want to bend your knees, and then you want to pretend like you're trying to zip up a pair of jeans that haven't fit you in a while, that are too tight. So you just want to draw that in, and you'll hold it for 5 seconds. And along with that draw-in, what you also want to do is a Kegel. So that's like when you're going to the restroom, number 1, you're going to contract those muscles like if you're going to stop the flow of urine. So that's what you're also going to do while you zip it up. The jeans, you're also going to stop the flow of urine with the pelvic floor muscles. So a lot of those muscles are actually joined together. When you contract one, it contracts the other. But if you focus on doing both, you're going to get the maximum benefit from it at the pelvic floor level and also at the lumbar spine. So that's going to help you brace when you do certain activities. If you're not bracing and you bend over, that's when people, you hear them like throwing their back out because they didn't support their spine for that task, and then it became misaligned and pinched. And then, a lot of times they can fall or just have a lot of excruciating pain, radiating symptoms down the leg. But yeah, so we want to work on strengthening and stabilizing that area of the back. So the repetition is 10 to 15 reps, and you want to hold it for 5 seconds for this transverse abdominis activation. We can also call it puck and tuck. So now that you learned how to contract your transverse abdominis for bracing, we're going to be moving on to bridging, which you're going to be using that transverse abdominis for bracing to solidify your pelvis with the low back while you do the activity. So first, you want to draw that in, and then you're going to lift up your glutes, and you're going to hold it for 2 seconds, and then come back down. This is good. You're going to do this for 10 reps to 15 reps, and you're going to hold it for 2 seconds, and that's going to help strengthen your glute muscles. This next exercise is called dead bug. First thing you want to do is contract your transverse abdominis muscle here to brace for when you lift your legs up. Next step is you're going to bring your feet up off of the table, and still while holding and maintaining your transverse abdominis here, you're going to bring your right arm up, and then your left leg comes out as well. So you're just going to alternate left and right. To make it more challenging, you want to raise your head up about an inch and do the same thing. Right arm, left arm. So continuing to strengthen the core, what we're going to do is we're going to work on the rectus abdominis by doing some crunches. Place the hands behind the head, support the neck, and you're going to hold it for 2 seconds at the very top. And you'll repeat this for 10 to 20 repetitions. After that, we're going to work on alternating crunches. So with this one, you're going to bring your left elbow towards your right knee. And you'll repeat this for 10 to 15 repetitions each way. This next exercise, we're going to be performing side crunches. So what you want to do on this one is bend both knees, put your hand over here so you can feel the muscles working, and then you're just going to crunch to this side and then back down. So now let's discuss sciatic nerve pain. So the lumbar spine and sacrum will collect nerves and shoot it down the hip and down the leg into the foot. So if you have sciatic symptoms, we're going to relieve some of the tension by doing a sciatic nerve glide. And what you're going to do is you're going to have the opposite knee bent to support the lumbar spine curvature. And what you're going to do is you're going to hold behind the knee, and you're going to kick up towards the ceiling, bring your foot back towards you at the ankle, and you'll hold that for 2 seconds, and then come back down. Back up, bring your foot back towards you. Once this becomes too easy, what you're going to do is you're going to do it in cross body. So you're going to come up, bring your foot back towards you, and then bring it across, and that's going to put a little extra stretch on it once it becomes more mobile. And I recommend doing the Piriformis Stretch before this one in order to release the tension from that nerve, because the piriformis actually pinches on the sciatic nerve if it gets too tight. And then if you have tightness in that piriformis muscle in your hip, you're actually going to get symptoms that will radiate down here, even if you don't have real sciatica that actually comes from the lumbar spine by a pinched nerve. You could have pseudo sciatica, which is just tightness in that hip, which pinches on that sciatic nerve, and then it'll send it down the leg, but it'll mainly just be at the hip level and nothing at the low back.
Now we're going to work on the posterior chain of your back and your hips. So this next exercise is called the bird dog, and if everybody was watching the posture video, you'll know that this is my most favoriteest exercise in the whole world when it comes to low back pain and low back strengthening. So what you want to do on this one is you're going to do alternating right arm and left leg, and switch. Left arm, right leg. And you hold that for 5 seconds 3 to 5 seconds, and you want to do 10 to 15 repetitions. And when you do this one, you want to also make sure that you're bracing your transverse abdominis. This next exercise is called plank on knees. And for this one, you want to definitely draw in your stomach for that transverse abdominis for stability. And then you want to hold this one for at least 30 seconds to up to a minute. Once a minute becomes too easy, you're going to bring your feet out. And then you want to try to keep your body straight in the line. Also making sure you're going to be contracting that transverse abdominis muscle, puck and tuck. And you want to hold this one for 30 seconds to a minute. And then come down. So now let's work on a little bit more advanced move with strengthening your trunk rotators. So what you want to do is place a band and attach it to something sturdy. You're going to rotate to the right and then all the way to the left. And then make sure you keep those transverse abdominis muscles tight while you do it for stability. And you repeat this for 10 to 20 repetitions. If you are following the postural series, you'll remember that we did some back extension on a physio ball. If you have access to a back extension machine like this, I also like to use this for lumbar traction and also decompression of the other spinal muscles as well. So for decompression purposes, I'm going to have you hang down. I like to grab onto to kind of get a little stretch. And I'll just hang here for at least 10 to 15 seconds. And once I feel like I've kind of decompressed the spine, we're going to strengthen this new opened position. So being right in the center, what you want to do is you're going to cross your hands to your shoulders, and then you're going to extend straight up, and then come back down. After repeating 10 to 15 repetitions, you're going to do an alternating rotation. So just like the physio ball as well, we did a rotation at the very top and then coming down. And I'll perform at least 10 repetitions on each side for this one. And at the very end of it, once I'm done with rotation, I'll do 2 more repetitions. So the first one's going to be directly straight to kind of realign everything after rotations. And then the very last one, we're going to do the same thing, but we're going to come up almost like in a cross position with like in a T. So we're going to almost look like we're going to fly. So we're going to come up, hold that position, and then brace and come off the machine. Good thing about that one is that you're also going to be strengthening your scapular muscles, so the low back, shoulder blade muscles, all that helps with posture. Another spinal decompression technique is doing just a simple bar hang. So you want to have your hands on a bar if you have access to one, and just pick up your feet. And what that's going to do is that's going to decompress your spine, separate the vertebrae to allow the nerves to exit out the vertebral canals. I'm going to hold this one for about 10 to 30 seconds, and that's just going to allow more motion and mobility in between the vertebrae. That concludes our video for today. Thank you for joining in from the mechanic shop for the low back series. Stay tuned, we're going to get more specific later on different conditions of the low back, but as per usual, stay tuned and get strong with the mechanic shop.